Okay, so now we really will get going. So, welcome back. I want to give a little bit of an introduction as to what we're doing here. I know that the order of operations here is slightly different because of all the excellent talks we heard just before this. So, this is our combined problem and solution pitching. Session here. We're going to slightly change the format, although not too much. What we'd like people to do is to come up. If you're a member of a team and you want to be that team's representative and that team is already more or less formed, that's great. Please come up, and I'm going to ask people who want to give pitches to come up here on the left, and I'm going to hand you a number, and that number is going to be your team number. If you could then come up here in order, you'll have 90 seconds. We were going to do 60 seconds before, but we've decided to extend that to 90 since we're doing it in this combined fashion. And basically what we want to hear is, who are you? If you have a team, who is the team? What is the problem that you're trying to solve? And then if you've come up with some kind of mechanics that you'd like to implement for coming up for a solution, great. If you don't have one yet, that's fine too. And then, do you have any needs that are outstanding? Meaning, do you need a programmer? Do you need a clinical expert? Do you need whoever it happens to be? If you're an individual who has not joined a team, two ways to approach this. One is you listen very carefully to all the pitches and you find something really interesting and you know that's what you want to work on. Or we get to halfway through this, you haven't really heard something you want to work on yet, and you come up and pitch an idea yourself. The goal here is to both communicate broadly what people are working on so that people can efficiently organize themselves into teams that can be effective toward that particular problem and solution. And I think that's kind of it. We will keep people on a pretty strict timeline. So someone's literally going to be keeping time. At 90 seconds, we are going to cut you off. If you finish beforehand, that's fine. So I'd like to invite Turner Baker, who is a winner from last year's hackathon, one of the winning teams. He's going to come up here and he's going to give an example 60 or 90 second pitch. I don't know where he is. Where? Oh, you're right there. Just to seed exactly what the idea is that we have here, I've already coerced two teams to coming up to giving number one and number two. And live, while you're giving those pitches, Peter is going to be up here. I'm going to be over here handing out numbers. Peter's going to be over here, and he's going to be writing down a little bit about your team in order of pitches here on this Trello board that everyone should have access to. If you do not, that's easy for us to fix. Just let us know. Okay, so after you.
Hey guys, I'm Turner. I was in the group that one of the finalists last year, so I'll give you guys, I guess, the problem pitch and the solution pitch that we used last year to start it all off. Last year was cancer, but the problem and solution kind of run true for this one as well. The big problem that we felt that there was in the med tech market is that when you go to make a clinical trial, when you go to like prove out any drug or device, you have to make this 40 to hundreds of pages long document that's very specific. It has to get approved and accepted eventually by the FDA. But before that, it has to get approved by local IRBs and your own institutional IRBs, and before that, your boss, right? There's no real recipe in which to do that. It's just kind of everyone has secret recipes depending on the department or your own PI. So that was the problem pitch. The solution was that we thought that you could just make like a TurboTax for protocols, right? Where you kind of describe the trial that you want to run, or you describe aspects of what it is you want to do, and then it designs a template that you just then fill out. So you're not making any mistakes, and you're checking all the boxes, and then eventually maybe you could have it use AI to kind of grade you and give you a grade out of 10, whether or not it's probably going to pass IRBs or pass the FDA and stuff like that. So then it kind of just standardizes the whole thing. Institutions can make registries of successful protocols or unsuccessful protocols. So it was kind of a multi-layered solution that addressed kind of a very simple problem. So yeah, it wasn't a very sexy problem. I'd say it's very boring. But sometimes unsexy solutions are extra sexy to people that are trying to invest money. So, yeah.
Okay, so the first couple of teams have already agreed to come up and give their pitches in order. So would team number 1 come up? Can't remember where you are. Oh, there we go. So for those of you that want, while this is happening, I'd like the people who are representative teams or who want to give a pitch to come up and line up here. You go ahead. Yeah. So that I can give you a team number and so that we can record what you say up here. We are going to be keeping very strict time. I'm glad that everyone is standing up. This is spectacular.
Totally different now? Okay.
Hi, my name's Jesus. So one of the solution. This is my teammate Osama. One of the problems that we focused on was this idea of like second opinions, and how it's difficult for patients to go between institutions, go between doctors, like, and get those resources. Do you want to address?
Yeah. So it could be really difficult for someone to find their diagnosis because of two things. It could be either the wrong diagnosis that they're getting in the beginning, or it could be a late diagnosis altogether. And so getting a second opinion can make it a lot more easy and more quick to reach that correct diagnosis. Issue is, though, it's kind of very difficult to do that. It's not easy to reach out to a certain doctor in the right amount of time because of the cost of something like that, and because of how difficult it is to reach out in general. And so if there was sort of a system to make it easier to get a second opinion on a given case in a quick, efficient format, it would help a lot. The idea of it is that it's not so much of a remote virtual doctor where that kind of thing has tried and failed because that it doesn't work, but it's more of just a one-on-one consultation of, okay, here, this is my input on what's going on, and then you could return to your primary caregiver and have that insight on it. That's about it.
Great. I'm going to ask you to go back and
Thanks very much.
modify. I just create a template for you. Sure. Update this.
All right, team number 2. If you already have a card up on Trello, please let us know so we drag that over.
Yeah, if you already have a card?
Yeah.
You do? Okay, so what we'll do is if you already have a card, we'll just drag it over.
Oh, no, we don't have a card.
Oh, you don't have a card?
Yeah.
Okay.
Sorry.
Okay. So, are you on Trello?
No.
Okay, you have to be on Trello. We'll take care of that afterwards. But
Hello, how's everyone doing tonight? My name is Haloon, this is Shoham, and this is our pitch. So we got news of this patient suffering from sickle cell anemia for about a few months. Every month, a lot worse. So what happened was he heard about this experimental gene therapy from his mother, actually. We don't know what kind of experimental gene therapy, and that matters, because what happened was after 6 months, he saw a lot of success. He felt like loads better. This is very interesting because we have no knowledge of those 6 months. It was this massive empty space of data, of records, of documentation that we don't have. And honestly, I think we have a pretty good idea as how to map that, because there's quite a lot of data, scientific information, and let's just be honest, money in those half years. But yeah.
Yeah. So I guess and so one of the main points was that he got the clinical trial information from a brochure that his mother had gotten. And so one of the things that we want to address is how patients get access to these clinical trials. The main way was clinicaltrials.gov, but it's very clunky and sometimes it's very difficult for patients to use. So having and we all know UI is a pretty big issue in healthcare, whether it's with doctors or with patients themselves. So the main 3 points that we sort of want to track is a patient UI and a doctor UI that better reports sort of the daily troubles of a patient as they're going through the symptoms, because every 6 months or 2 months or 3 months that patient would report to the doctor, and having daily track of how his symptom is going is very important. The second is track effects of medication and the progression of treatment. That also goes into the profiling and reporting. And then finally, the patient profile that leads to the clinical trial recommendation, which has a lot of value for patients, doctors, and companies. Yeah.
Thank you.
all right, so go on Trello and from the link that was sent out to everyone, and then I'll put a little right here. You can change the title.
Maybe just a keyword summarizing so people can clue into it when they want to
Yeah.
connect with you. So the first one was a second opinions, this one was...
Yeah, I'm just putting the title. You guys can find the card once you're on Trello and modify this and upgrade it, all the information you need to convey your idea.
Thanks very much, guys.
Thanks.
Number 3.
So I drag my card? Yeah, sure. Okay. My name is Diane Del Val. I study the genetics and genomics of rare epilepsies here at Mount Sinai. And my goal is to make a sort of dating app for patients and researchers. One of the major bottlenecks in conducting genetic research is actually getting these large cohorts, especially when you're looking at things like de novo variants, which we know are the main cause of these rare phenotypes. So my goal would be to use HPO, which is Human Phenotype Ontology codes. The recent Nature review has proven that these are actually more sensitive than using ICD-9 and ICD-10 codes for creating phenotypes of patients and actually grouping them correctly. So using HPO and matching algorithms like you would do on like Tinder or eHarmony, matching someone with a program and actually facilitating the interaction between researcher and potential participant and biospecimen collection, which is an additional problem, especially when you're collecting remote patients and you're looking at things like mosaicism and collecting saliva samples, which we know are not as immune regulated. So a lot of the times you'll get like false positives because you collect a lot of variants in the saliva that you wouldn't get in like the blood, or if you're looking at somatic variants, which are also typical, at least in my disease field of study, in epilepsies. So yeah, that's it.
And also add yourself to the card so we can people can find you. And if you're
So Sun-Infant syndrome is a condition or a phenomenon that occurs to about 3,500 infants in the U.S. every year, and therefore falls into the category of rare diseases. It's a bit of an interesting rare disease because unlike other genetic rare diseases or rare diseases where you can easily, isolate causing factors, SIDS is almost defined by the lack of a causal factor. One of the ways it's addressed is with baby monitors. The state-of-the-art uses pulse oximetry. However, pulse oximetry is fairly inaccurate for infants and it's not too well known, so we are proposing a non-contact baby monitor based off of a novel radar technology, solid-state radar. That's all I have to say about it. Thank you.
Okay, my name is Jake. So 80% of these rare diseases have a genetic component to them, and 1 in 10 people have them. Now that corresponds based on the fact that there's so few people per disease that out of the 1 in 10 of you in here, presumably, who have rare diseases, you all probably have different ones. So there's a huge variety in these diseases, but there's not really any kind of unified format for testing any one disease. You have to go to your doctor and they have to go through a list of symptoms and try to figure something out for you, right? Now, there's a really cool technique called surface plasmon resonance. Imagine a balloon rubbing it to your head, right? You get a little static field around that. Imagine the same thing around a nanoparticle, bouncing a laser off of that. The way that field changes the way the light bounces. So you can create a spectrum based on antigen-antibody binding on these gold nanoparticles. So my proposal is you create a phage display library of a whole bunch of different antibodies that correspond to a bunch of different proteins, the wild types, the healthy types, that we know are functional, the active sites there. We don't know what is actually going to cause the rare disease, but we can tell, okay, this particular antibody didn't bind when it should have to this active site that's crucial in some pathway, right? So you can say, I know this pathway is failing. So it allows you to kind of get a picture of your patients and find some kind of personalized medication. You could direct them, at least point them in the right direction so they know what diseases they could be looking at. So it helps you narrow down very, very quickly. Surface plasmon resonance is real time. It's antibody-based, so you can just functionalize the surface very quickly, and it requires only basically a laser and a prism, so it's a relatively cheap technology we could just deploy out to fields. And then the actual deployable itself is just a cover slip, so I mean, it can be sent anywhere in the world via drone or something like that. Perfect, look at that. Number 5.
Just a quick reminder, it's also helpful if you have time in your pitch to ask for the kind of teammates you're looking for, kind of help you're looking on your team.
Programmer UI.
Hey everyone, I'm Scott. I'm here to pitching the idea of because everybody know as one of the presenter mentioned, it's hard to collect data about the rare diseases because it's so sparsely distributed, and also government is less likely to fund that because it's only helping a limited amount of people. So my idea is to help everybody to find an incentive to likely to build a website or like educational purpose website or just like a chatting app to help people to connect with the patients and patients to connect patients and patients to connect doctors or doctors connect to the local doctors to find a way to connect people, but also we kind of as a backend to collect the data around them to like a pop-up quiz or like streamline the data into a set database and then use natural language processing or like other kind of techniques to translate different language into one standard language or kind of categorize every information of the disease into a streamlined database to allow us to formalize a reference book for local doctors or nationwide doctors to have a symptoms to look after, to reference from to diagnose the disease to avoid some like misconceptions or kind of things like that. So yeah, that's it. Thank you.
Hello everyone, my name is Sinha. I'm from Stony Brook University. I'm a PhD candidate in computer science. So I'm here with my team, consists of 5 people with similar backgrounds. Surprisingly, so they are all in the building, but only one of them is here, sitting in the audience, and the other 4 and they are not here. So our problem is, consider that, okay, so for the rare diseases, consider, for example, patients with ALS cases. They have very limited physical capability. So they can think, but they could not walk, they could not talk. And they should always be dependent on others to help them to do everything, in their life, even, for example, turning their bedroom light on and off. So our problem is that, with all these advanced technology, how we could increase their quality of life and give them ability to do things on their own. So our project is I Can Do. So it is an app for iPhone or iPad. So the patient could look at the screen, and we want to link that with the smart home devices. So with the eye tracking technology, so the patient could, for example, toggle the lamp for the bedroom, turn the fan on or off, or, for example, opening the door even. So I think in that case, it could, definitely give them more independence, in their life. Thank you very much.
Hi everyone, my name is Diane. I'm a resident doctor at Mount Sinai. I have an idea to provide a diagnostic tool to help clinicians diagnose rare diseases, because a lot of these diseases are very rare, and many clinicians, especially generalists, may not have seen these diseases in their career. And so the idea is to have a machine learning type of product to where the clinicians can give symptoms, and the product would generate likely diagnoses that the clinicians can then drive their workup from. And once the patient is diagnosed, to have to be able to keep a registry of patients in case there are research ideas for such diseases in the future. And so right now I have a team. We are looking for user design people and software engineers. And so if you really want to make an impact, join our team. Thank you.
Yeah. Hi guys, my name is Jeevan and I'm a software developer. So our idea is to create a central repository of all the information that we can gather from a user. For this, we'll be creating like a very user-friendly app wherein the patient would be entering data on a daily basis, saying like general information about how he's feeling. And once we have all this data and we identify that this person has been diagnosed with a rare disease, we'll flag this person saying that he has this rare disease, and once we have identified that, we'll find patterns within the data using machine learning and try to figure out similar patterns to identify other people who might be having this disease. And we'll just send them notifications saying that you're likely to be having this particular disease, and if that's the case, then this is the best person to contact. And we'll have a repository of all the hospitals that are able to treat all the known rare diseases, and whoever we have identified, we'll just send them notifications for the same.
Yeah, and we also plan to send them notifications of like clinical trials, any ongoing clinical trials pertaining to their condition, and to guide them effectively to specialists, since it can be really overwhelming and they generally they don't know where to go, and kind of like providing a user-friendly interface, and also have a follow-up survey and provide reviews based on which we can direct the user where to go.
Change whatever you want. Yeah.
Well, I think great minds think alike, because I think the last two plus mine are kind of similar. But, I'm a general internist, and Dr. Gabrieloff and Kim have mentioned that, the diagnosis of these diseases is difficult. And when you only have 15 minutes or less to diagnose somebody with, non-specific symptoms, it's just very hard. So, but I will tell you a story of a friend of mine who, at age 30, went to see her doctor for restless leg and inability to sleep, was put on Neurontin, and after a few weeks of being put on Neurontin, which helped the restless leg, she was not able to get up in the morning. She had to pry her eyes open. She wasn't tired, she just had to physically pry her eyes open. And when she walked, as she walked, her muscles were got weaker, and she had generalized muscle fasciculations. So going back to see her doctor, he was like, well, I don't know. Well, they continued the medication, and eventually they stopped it. Fasciculations continued, the eyes, inability to open them continued, and she had to advocate for herself. Labs were negative, and she waited 6 months to see a neuromuscular specialist here in New York. So, who thought it was all in her head, but because she mentioned the eyes, he looked up myasthenia gravis, did the blood work, and she was positive. But it was an unusual presentation for it, because it's usually at the end of the day, not in the beginning. So I'm looking for someone to help design an app so people can include the information, put symptoms as they go, for people who have been diagnosed and who haven't been diagnosed, so that we can use predictive analytics, machine learning, and just help people get diagnosed earlier. So I'm looking for anybody. Computer.
You guys didn't create a Trello card yet?
No, we didn't yet.
No, okay. Well, we'll just put this up for now.
All right, great. Wouldn't it be great if we didn't have to wait for a hospital checkup to know how the patient is doing? Right now, we have to keep on waiting until a patient comes in to us and say, hey, my child has seizure this day, this day, this day. But imagine if we could just check up on them daily. What could we do to get more data points and also know how they're doing on a regular basis?
Okay, hi, my name is Victoria. So one of the, in order to have a solution to this problem, what we decided was that one way we could address this is to have a portable in-home EEG. And so right now there are some at-home EEGs, but they're really cumbersome and they're often just like plastic hard hats. So our idea is to take this EEG and make it into a softer, of like the form of a beanie. And so then that way we can be able to monitor and get that data for the physician and improve that whole experience between the patient-physician interaction. We are looking for electrical engineers and also software engineers to work the user interface and also marketing. Thank you.
So the rare disease that our group focus on is acute myeloid leukemia. You know, like patient with this kind of the rare disease, the bone marrow transplant is kind of the only solutions. So the clinician accept the patients and they go to the siblings, do low resolution HLA test, match their siblings with either shared mother or father, and then if the match is like usually is 6 out of 6 allele matching, antigen matching, and if they ran out the relatives who can do like almost like usually 30% without like matching the good candidates, they usually go to the beta match registry to looking for non-related donors, and the beta match registry is centralized with the advanced search functions. But with that function, even a lot of people have to wait 1 to 2 years to get a donor match, and luckily they get a match. And so after interview a lot of like physicians who use the registry, and they got their 2 problems that are most likely to delay the process. And the first one is they have like a minimum pool for minorities. They got over 50% for coming from the Caucasian males, and which is good for like Caucasians. And for the minorities, and there's not much people like who registry for the donation. So here, increasing pools, and the second is that because of the budget problem, they can only go for 2 promising candidates, contact 2 candidates, whether for their like giving 2 weeks to them to respond, and it really like increased the waiting time. So we're going to create an app, and first to let them know and you are being targeted, or you are being like hit as a potentially target, and be the like promising targets and candidates. And then we want to get their like updated information, for example the contact information and their health status, and if there's still willingness to donate, and so that can be shortened some period of time. And we want to do a networking so that like a lot of the minority peoples can refer their friends who are coming from the same background to join to donate. So we're calling for help from people who are familiar with software engineering and who know specifically API, so for synchronized app with database registry. Yeah, thank you.
All right, so many of you tonight had a Diet Coke or other diet beverages, but for many patients with inborn errors of metabolism, such as phenylketonuria, that choice could be a life or death, or at least a very miserable decision that they made. So we were initially interested in looking at rare diseases of inborn errors of metabolism and other food-related illnesses that might be treated with changes to diet. So with a lot of these like inborn errors of metabolism, specialized diets are costly and gross, and patients really don't know what foods they can and can't eat. And often these patients don't really quantify what they're eating in a way that's actually useful to doctors and researchers and other downstream analyses. So, we thought that food is medicine, and, we really are what you eat. And in many diseases, diet can greatly impact a patient's symptoms and quality of life.
So we have a team right now, and we basically have bioinformatics, we have clinicians, but we want more clinicians. We want possibly someone to help us with software development, a UI person, just to kind of create more of a user-friendly app that patients can use and would want to use, that can track things. And it's something that people would want to use every day, something that could log information, log the food that they eat, something that they really wouldn't mind using to benefit their health, and doctors could recommend it to their patients as a possible way to help them. And also diagnosed and undiagnosed patients too, and give the undiagnosed people recommendations based on the information that they put in and stuff, yeah. So, yeah.
Thank you. You guys have a card here,
Nope. Just came up with this now. So this was inspired by Dr. Tabb's reference of pediatric patients and realizing that many peds with rare diseases have to go through one or many operations. Anyone who has been in an operating room realizes it's a pretty scary environment, or even like a dentist office is really scary. Something like that for a pediatric patient and their family is even worse, I'd imagine. If you can remember going to the dentist as a kid, it's probably one of the worst experiences, and multiply that by 1,000, and that's what you get in an operating room in neurosurgery, which we're used to seeing. A couple personal anecdotes to that. My cousin's baby was diagnosed with craniosynostosis, which is a skull malformation, so he had to go through a ton of surgeries. And she would sit in, my cousin would sit in the MRI machine with him in order to keep him still. So there needs to be something to keep families calm, keep babies calm, whether it be in that situation or within the operating room, instead of bringing parents in like white bunny suits that don't exactly look like their parents anymore. So we're looking for just a way to solve problems such as that within the operating room environment. Nothing specific at hand right now. And then people that we're looking for is clinical people that are involved with working with pediatrics, design engineers, people with disposables experience, wearables, and just general nerds or people who want to help kids.
All right. Hello. My name's Shay. I'm a first-year medical student here.
And I'm Andrew. I'm also a first-year medical student.
We're working on, so a lot of different rare diseases can cause different types of retinopathies. And we're kind of working on an application that can catch these early, kind of like a screening application. Just talk to us if you want more info, but we're looking for 4 types of people. Mobile app devs, ophthalmologists, people who know ophthalmologists, people who can get ophthalmologists on the phone in 48 hours, and anyone who has any type of experience with ophthalmology.
Yeah.
So,
and
cool.
mobile app dev. Yeah.
Yeah, again.
Thank
Cool.
you.
Thanks, guys.
All right, thanks so much to everyone who has already pitched.
Yeah.
Oh, no,
No,
go. So we have at least one more. Anybody else who wants to come up, either as an individual or as a team, please do. We've got one more at least now.
Hi, it's me again. I'm pitching on someone else's behalf now because they don't want to come up. Osteogenesis imperfecta is a condition also known as brittle bone syndrome. And one of the ways it's currently treated is by inserting what are essentially metal rods into bones. The issue is that as people with osteogenesis imperfecta grow, those rods don't grow with them. So this requires constant surgery to go in, replace the rods, and then repeat this over and over until they eventually mature. So one solution we have to this is, instead of looking for an internal device, we could have an external device that would be able to be adjusted with the person until they reached enough, a certain level of maturity in their physical development where we could permanently implant something without having to worry about constantly operating to increase its length. Thank you.
All right, any other pitches? Okay, so this is the end of our programming for this evening. Couple of things to keep in mind. You now have until 11 o'clock to get your final teams in. So that means you should all talk to each other, socialize, talk about your ideas. For those of you who had similar ideas, talk to the people who had similar ideas. I did my best to make notes for those of you who didn't already have copies out here, frantically on my phone while you were speaking.
Great job.
And let's see, what else do they need to know? Everything's due at 11?
Some of you aren't on Trello yet. If you didn't get the link because you registered last minute, then I will just come find me. I'll sit out there and I'll send you out a link to join Trello.